A sexual psychopath is a term commonly used to describe an individual whose sexual behaviors and desires are primarily driven by deep psychological disorders, often involving a lack of empathy, morality, and a disregard for societal norms. This term, while controversial and not always recognized in modern clinical psychology, has historically been used to categorize individuals who engage in violent or extreme sexual behaviors that are harmful to others, often associated with predatory actions, such as sexual assault or exploitation. Here's an in-depth breakdown of what a sexual psychopath might entail. 1. Psychopathy and sexuality. A sexual psychopath combines the traits of psychopathy with deviant or violent sexual behavior. Psychopathy is characterized by a range of personality traits, including lack of empathy. Sexual psychopaths have little to no ability to empathize with others, particularly their victims. This absence of empathy allows them to engage in harmful sexual activities without remorse or guilt. Manipulativeness. They often use charm or deceit to manipulate others, and may target vulnerable individuals to exploit them for their own sexual gratification. Superficial charm. Like other psychopaths, sexual psychopaths may be skilled in pretending to be friendly, charming, or charismatic to conceal their true nature. Impulsivity and risk-taking. Their actions are often impulsive and driven by a desire for immediate sexual gratification, with little regard for the consequences or the safety of others. Narcissism. Many sexual psychopaths display extreme narcissism, believing they are superior to others and entitled to act however they choose, even if it causes harm. 2. Characteristics of sexual psychopathy. A sexual psychopath is typically characterized by the following behaviors and traits. Sexual sadism. Many sexual psychopaths derive pleasure from inflicting pain or suffering on others, particularly in a sexual context. This can manifest in various ways, from physical violence to psychological manipulation, where the victim is made to experience fear, humiliation, or pain for the perpetrator's pleasure. Paraphilias. Sexual psychopaths often exhibit paraphilias, which are atypical sexual interests that can involve non-consensual or harmful activities, such as pedophilia, exhibitionism, voyeurism, or fetishism. These desires may be intense and uncontrollable. Sexual coercion and violence. They may use force or coercion to engage in sexual acts with others, including rape, sexual assault, or exploitation. The use of manipulation, force, or threats to achieve sexual control is common. Lack of remorse or guilt. A defining characteristic of a sexual psychopath is the inability to feel genuine remorse or guilt for their actions, regardless of how traumatic or damaging they may be to their victims. 3. Causes and risk factors. The exact causes of sexual psychopathy are not fully understood, but there are several contributing factors that might influence its development. Genetic factors. There is some evidence suggesting that psychopathy may have a genetic component. Individuals with a family history of criminal behavior, particularly violent or sexually deviant actions, may be more likely to develop psychopathic tendencies. Neurological factors. Brain abnormalities, particularly in areas responsible for impulse control, empathy, and emotional regulation, have been linked to psychopathy. Dysfunction in areas like the prefrontal cortex, which is associated with decision-making and moral reasoning, may play a role in the behavior of sexual psychopaths. Childhood abuse or neglect. A history of severe childhood trauma, including physical, emotional, or sexual abuse, can contribute to the development of psychopathic traits. Such experiences can distort the individual's understanding of boundaries, empathy, and appropriate sexual behavior. Environmental factors. Exposure to an environment where deviant sexual behaviors are normalized, or where violent behavior is tolerated, may increase the risk of developing psychopathic tendencies. A lack of stable, supportive relationships can also contribute to emotional disturbances that manifest as sexual predation. 4. Behavioral patterns and tactics. Sexual psychopaths typically engage in predatory behaviors, often targeting vulnerable individuals or exploiting situations where their victims are least likely to resist. Some of the key tactics they employ include grooming. In cases involving minors or vulnerable adults, sexual psychopaths may engage in grooming behavior, where they gradually build trust with the victim in order to manipulate them into sexual activity. Deception and charm. They may deceive victims or pretend to be someone they are not in order to gain their trust. They may also use charm and charisma to make themselves appear trustworthy or appealing, masking their true intentions. Isolation. Sexual psychopaths often work to isolate their victims from friends, family, or other support systems, making it easier for them to control and manipulate the victim. Gaslighting. They may employ psychological manipulation, making the victim question their own perceptions, memory, or reality in an effort to maintain control and avoid detection. 5. Psychological diagnosis and treatment. In clinical settings, sexual psychopathy is typically assessed using various diagnostic criteria. However, due to the complexity and lack of a specific diagnosis for sexual psychopath, clinicians may rely on broader personality disorder diagnoses, such as antisocial personality disorder, ASPD. This disorder is marked by a pattern of disregard for the rights of others and a lack of remorse for harmful behaviors. Sexual psychopaths often meet the criteria for ASPD, as their behaviors are aligned with the traits of this disorder. Narcissistic personality disorder, NPD. Sexual psychopaths may also exhibit narcissistic traits, such as a sense of entitlement and a need for admiration. Paraphilic disorders. For individuals who engage in sexually deviant behaviors, they may be diagnosed with a paraphilic disorder if their sexual interests or actions consistently cause distress or harm to others. Treatment for sexual psychopaths is highly challenging and often met with limited success, as they tend to lack insight into their condition and are unlikely to seek help willingly. Psychotherapy, including cognitive behavioral therapy, CBT, is one of the primary treatment approaches, but it is difficult to change deeply ingrained psychopathic tendencies. Furthermore, medication may be used in cases where there are co-occurring conditions, such as anxiety or depression, though it does not directly address the psychopathy itself. 6. Impact on victims. The impact on victims of sexual psychopaths can be devastating and long-lasting. Victims often suffer from physical trauma, psychological damage, and a range of emotional and behavioral problems, such as post-traumatic stress disorder, PTSD, anxiety, depression, and difficulties in forming healthy relationships. Many victims also struggle with feelings of shame, self-blame, and guilt. 7. Legal and social implications. Sexual psychopaths are often involved in criminal activities, and their actions may lead to legal consequences such as imprisonment or civil commitment. In some jurisdictions, individuals who are considered to be sexual psychopaths may be subjected to long-term psychiatric care or even lifelong monitoring after release from prison, as they are considered to be a high risk to public safety. Society often views sexual psychopaths with great fear and mistrust, given the severe nature of their crimes. Conclusion. A sexual psychopath is an individual whose sexual behaviors are deeply entwined with psychopathic traits like a lack of empathy, impulsivity, manipulation, and a disregard for societal norms. Their actions are often violent, predatory, and harmful, and they show little to no remorse for their behavior. While treatment is difficult and often ineffective, understanding the psychological and social factors that contribute to sexual psychopathy is crucial for both preventing these individuals from harming others and supporting the victims of their abuse.